In a world full of invisible threats, how do we actually build a planetary shield? Today, we're going to break down the blueprint for global viral outbreak preparedness. Let's get right into it.
Okay, first things first, we got to understand what we're up against. The World Health Organization uses this term, disease X. Now, it's not a real virus. Think of it more as a placeholder for the great unknown. It's the next new pathogen that could pop up and spark a global epidemic. It's a concept that really forces us to prepare for a threat we haven't even met yet.
So where is this threat most likely to come from? Well, take a look at this number. A staggering 70 to 80% of newly emerging infectious diseases are zoonotic. What does that mean? It means they jump from animals to humans, spilling over right at that complex, messy border between our world and the natural one.
So what makes these viruses so darn good at making that jump? Honestly, it's all in their genetics. You see, a lot of these dangerous pathogens are what we call RNA viruses. Now, unlike our own DNA, which has this built-in spell checker when it copies itself, these RNA viruses are, well, they're sloppy. They make mistakes when they replicate, which leads to a ton of mutations. And this creates a constantly changing swarm of new viral versions. And all it takes is one of them to find the perfect key to unlock our human cells.
Okay, so faced with this constant evolving threat, how in the world do you build a defense? The whole game is shifting. It's not about waiting for an attack anymore. It's about proactively activating a planetary-scale security system, a shield built from technology, smart strategy, and most importantly, collaboration.
And this right here, this is the core architecture of our global shield. It's built on 4 powerful, interconnected pillars. But look closely, what's right there in the middle, connecting everything? Coordination. Without that central hub, these pillars are just standing alone in the dark. They have to be seamlessly integrated to work as one powerful defense.
So let's actually break those 4 pillars down, because there's a really great way to think about this. First up, surveillance. These are our global motion sensors, constantly scanning for any sign of a threat. Second, diagnostics. Think of these as the high-res cameras that identify the intruder once it's been detected. Third, you've got prevention and control. That's our automated defense system, designed to neutralize the threat. And finally, research and development. This is the innovation engine that's always upgrading the entire system.
So, let's dive into that first pillar, surveillance. This is our invisible front line. It's the early warning network designed to spot a spark long before it has any chance of becoming a wildfire.
And today's surveillance is so much more than just counting sick people. On one hand, you have genomic surveillance, which is like reading the unique genetic barcode of a virus in almost real time. This tells us not just that a virus is spreading, but how it's changing and evolving. And on the other hand, you have something incredible like wastewater surveillance, which gives us this totally unbiased bird's-eye view of an entire population just by testing a city's sewage for tiny traces of the virus. And you want to know just how powerful that early warning can be? Look at this. In some places during the COVID-19 pandemic, wastewater surveillance spotted the virus a full 6 days before the first official clinical case was even confirmed. I mean, think about that. That's 6 extra days, a 6-day head start to ramp up testing, get hospitals ready, and let the public know what's coming. That's critical.
So what ties all this surveillance technology together? Well, it's this really important framework called One Health. It's based on a simple but profound idea. We can't protect human health in a bubble. By pulling together data from human clinics, from veterinary services, and from environmental monitoring, we can finally start to spot these threats at the source, that critical point where animal diseases can become the next human pandemic.
Right, so once our surveillance sensors go off and detect a threat, we need to be able to identify it and neutralize it fast. And that brings us to our next pillars, the countermeasures. This is our arsenal of diagnostics, vaccines, and treatments, everything we need to fight back.
And the speed of identification has been totally revolutionized. I mean, the super-accurate RT-qPCR test is still the gold standard in the lab, but now we have these new technologies like RT-LAMP that can give you a reliable result in as little as 13 minutes. This moves testing out of big, centralized labs and right into our communities. And there's even more coming, with tech like CRISPR-Cas promising even more precise tools for the future.
Okay, this slide right here, this shows what is honestly one of the biggest game changers in modern medicine. Just look at the timeline. For the Ebola outbreak back in 2014, it took nearly 6 years to get a vaccine approved. Now, compare that to COVID-19. Because of these new platform technologies like mRNA, we went from identifying the virus to having an authorized vaccine in less than a year. That's not just an improvement. That is a complete paradigm shift.
And what about treatment for people who do get sick? Well, that's become way more sophisticated too. It's really about a two-phase strategy. Early on, the goal is simple: stop the virus from making copies of itself. We do that with direct-acting antivirals, like Paxlovid. But later on in the illness, the danger often shifts. It's not just a virus. It's our body's own immune system going into overdrive. So there, the strategy is to use what are called immunomodulators, like baricitinib, to calm down that hyperinflammation and prevent serious damage.
But here's the thing. All of this incredible technology, the surveillance, the diagnostics, the vaccines, it's only as good as the system that deploys it. And that brings us to the central hub of it all, global governance. This is the command center for our planetary shield. You know, effective governance means we have to face the systemic failures we saw during COVID-19 head-on. The problem? Vaccine inequity. The solution? We need to build regional manufacturing hubs and actually ensure technology gets transferred. The problem? Data silos. The solution? We need policies for transparent, open data sharing. The problem? Fragmented last-minute funding. The solution? Establish predictable, sustainable financing before the next crisis hits.
Now, there is a major global effort underway to try and formalize all these solutions. It's called the WHO Pandemic Agreement. The goal is to create a binding international treaty. But let's be honest, the real challenge isn't just writing the document. It's getting all nations to make commitments that are actually enforceable, commitments that turn these great ideas into reality.
So let's tie this all together. The best way to think about viral preparedness is like a really high-tech security system for the whole planet. Our surveillance tools, those are the motion sensors. The diagnostics, they're the high-resolution cameras that identify the intruder. Vaccines and therapeutics, that's our automated defense system. And governance, that's the global command center, whose job it is to make sure every single room in our shared home is equally protected. We have built some truly incredible tools. We have learned some very, very hard lessons. We have the blueprint for this planetary shield. But this all leaves us with the ultimate question. After everything we've been through, is that shield strong enough? The answer, it's not just going to depend on our technology. It's going to depend on our sustained, unwavering commitment to innovation and global collaboration.
Awareness is the first line of protection. Share the information and subscribe to the channel.